Hi, I'm Josephine DeLeon, an epidemiologist at BlueDot. Today I'm going to assess measles in Indonesia and the Philippines for public health and life sciences applications. To perform this rapid risk assessment, I will be using steps 1 to 5 of the WHO STAR framework, from identifying a hazard to finalizing the risk profile. The first step is identifying the hazard. Using one of BlueDot's Power BI templates, I can see that measles has been increasing across the globe. In particular, we see a cluster of activity around Indonesia and the Philippines. Paired with intelligence from the WHO, which reports that vaccine coverage has decreased since the COVID-19 pandemic, I decide to investigate further. Next, I evaluate the likelihood by comparing current activity to historical. Luckily, Blue Dot has both historical cases and pre calculated annual baselines for measles. By comparing current activity to the expected annual baselines, I determined that while Indonesia is within the expected baseline, there is a higher volume of cases year over year and activity is happening earlier in the year. On the other hand, the Philippines is well below baseline of 25 to 50 cases per 100,000, suggesting that there may be issues with underreporting. To estimate the impact of measles activity on local populations, I used Blue Dot's outbreak vulnerability indicators, and I chose to examine the local population age structures and also their deprivation scores. Areas with high deprivation may be experiencing poor nutrition, lack of healthcare access, and also poor vaccination coverage. So, the regions with a high amount of reported cases, coupled with a high proportion of the population under 5, become the higher vulnerability areas. To determine my level of risk, I first evaluate the sources used to complete the analysis. Blue Dot provides source information for all data gathered, making it easy to perform further investigation if needed. But finally, I determined that the level of concern of measles in Indonesia and the Philippines is high at both a local and regional level. Should I want to determine a level of concern at a global level, I could also add some air travel analysis to assess the importation risk and also pair that with other vulnerability indicators. With the risk profile complete, we can start applying them to more practical applications that will help mitigate the disruption of these outbreaks. This includes identifying priority locations for vaccination and education campaigns, estimating the upcoming demand for countermeasures, and even sites with high disease activity for ongoing clinical trials. Now we know how to use Blue Dot's data with the WHO STAR framework to assess measles in the Philippines and Indonesia. If you would like to explore further, contact Blue Dot today.